Hi and welcome to this poster on sustainable provision of education in the transition from enhanced to advanced level practice. My name is Melanie Clarkson, I'm from Sheffield Hallam University, and I'm just going to take you through the introduction of this poster. So for those of you who are unaware, enhanced level practice is a valued level of practice within clinical and across the other four pillars. And it can be a career destination, or it could be part of a professional progression onto advanced practice. And one thing that we want to make very clear with this poster is that the clinical level of practice and the academic level of practice are two very separate things. And it's really important that academic educational institutions are aware of this and that they work with the individuals, with the employers, and with all of the governance in place to make sure that the education and training journey of the individual is reflective of what is needed within their clinical practice. So as I've mentioned, academic and clinical levels are very two different entities, and quite often when we move into postgraduate education, that is level 7, and we can't really change that in terms of splitting it for enhanced and advanced practice. So it's really important that we start to recognise the application of that knowledge, even if it is undertaken at an academic level 7. So for example, with non-medical prescribing, that's taught at level 7 for those obviously in a postgraduate, and the same with physical assessment skills. But actually it's the application to the clinical level of practice that we need to make sure we have that robust and rigour in terms of our governance from an academic and a clinical institution to make sure that that is fit for purpose. So it's really important when we start to think about that recognition of prior experience or prior learning, of how we consider the academic credit that is brought into a master's level and how that might be applied to a higher clinical level of practice. Obviously we need to make sure that that rigour and quality is still there, but we need to make sure that that application of that knowledge is applied at the higher level of clinical practice. So we were tasked with developing some guidance to support academic education institutions to be able to think about how we manage and develop that AAPE situation from the levels of clinical practice from enhanced to advanced, and the things that we needed to think about as we looked at that educational pathway.
Hello, Kim Stuart here from Coventry University, representing the Innovation Partnership with Salford University as led by Louise Henstock. The purpose of the NHSE guidance that was developed was to enable further clarity around AAPE processes, offering consistency of approach and consideration across enhanced to advanced level education programmes. In doing so, we considered the implications of these levels of practice and education, and any decision for AAPE must be reflected in the context of accountability to upholding quality and safety of care, meeting workforce and service needs, and working within specific professions and at the levels registrant's scope of practice. Broadly speaking, enhanced level practice relates to the development of knowledge, skills and behaviours that practitioners demonstrate working within their scope of practice across a specific pathway and/or sector of care. The hallmarks of enhanced level practice are the management of increasing complexity, risk, uncertainty and unpredictability within a particular sector or setting in a particular profession. It's around exercising professional judgment and independent decision making within that profession and that sector or specific area of care, around expanding their sphere of influence in how they advise others and manage aspects of service delivery, exercising clinical leadership, and proactively supporting others' learning and contributing to quality improvement. In developing enhanced practice education, the focus is on supporting practitioners' safe and effective development by building on their existing professional capabilities and their responsibilities as accountable registrants. It's about taking into account their profession, their role and their practice environment, as well as how this contributes to service delivery. enabling individual practitioners to fulfil the requirements of enhanced level practice within their personal registrant scope of practice. Apprenticeship training plans need to consider the transitions between enhanced practice and the recognition of prior learning should they wish to progress to an advanced level of practice. Both enhanced and advanced practice have separate and distinct occupational standards. The occupational standard for enhanced practice is set at level 6, whilst advanced practice is set at level 7. Within enhanced practice, there is no mandated academic credits, unlike at advanced level practice where the mandate is at level 7 for a full award of master's level education. In designing any AAPE process between these two occupational standards and in developing educational programs, it's essential for education institutions to assess against the knowledge, skills and behaviours of advanced practice from two perspectives in considering any AAPE. The first area is in establishing the level of knowledge and skills in which the apprentice needs to demonstrate at an advanced level in order to meet the occupational standard of advanced practice. And secondly, it's the demonstration of that practice within their service context in working towards and achieving advanced level practice. Achievement of level 7 learning within an enhanced clinical practice apprenticeship at an enhanced level is not equivalent to advanced clinical practice, and care must be taken to explore the apprentice's current knowledge, skills and behaviours within the context of the occupational standard in which they are applying to study at. And this goes beyond considering academic credits in isolation to the differing levels of practice. When considering levels of practice in the process of recognising prior learning, thinking about knowledge, it's considering the assessment of the apprentice's current knowledge, technical application and expertise within their role, considering this within their current role and as a trainee practitioner at advanced level. When we think about the skills that that practitioner is working within, we need to be able to demonstrate an assessment of their competence at practically applying those knowledge and skills both within their current role and as a trainee practitioner. And in terms of behaviours, it's looking at their current mindset, attitude and approach with consideration of how they are using this within their current competence and how they would then develop this as a trainee practitioner. Enhanced practice academic credits should be reviewed, and when satisfied that they meet the AAPE requirements, including experience in learning, mapping these to the advanced practice framework and occupational standard where appropriate will help to ensure that we have clear evidence on transitions between advanced and enhanced level practice. It's recommended that any process includes supporting evidence from the employer and the individual themselves, and any AAPE would need to be aligned to the Centre for Advancing Practice specific requirements for programme accreditation in meeting the advanced practice capabilities set out in the multi-professional standards of education and training. The positionality statement provided by NHS is there to support both the socialisation of the difference between enhanced and advanced level for education providers to be assured that they are also contributing to upholding quality of care and safety, meeting service and workforce needs and supporting our individual professions and across professions to work to their scope of practice.